Yes, so I presented the final analysis of our SAKK 1614 trial. The SAKK 1614 trial was a single-arm phase 2 trial investigating the use of perioperative durvalumab in addition to neoadjuvant chemotherapy in patients with stage 3A and 2 non-small cell lung cancer. The study design, it was, as already mentioned, it was a single-arm phase 2 trial for patients with stage 3A and 2 disease. So all these patients had confirmed mediastinal lymph node involvement. They were treated with our current standard chemotherapy that was established in our previous trials, so the SAKK 1600 and 1696, with 3 cycles of cisplatin and docetaxel, followed by 2 cycles of the anti-PD-L1 antibody durvalumab, followed by resection. So all these patients were deemed resectable at the beginning. So they received, as mentioned, 3 cycles chemotherapy, 2 cycles durvalumab were then resected, and postoperatively, so for in the adjuvant setting, they again received durvalumab every 2 weeks for 1 year. The primary endpoint of the trial was event-free survival after 12 months. And based on our previous findings with chemotherapy alone, with neoadjuvant chemotherapy alone, we aimed at improving 12 months event-free survival from 48% to 65%. So the primary endpoint of the trial, the 1-year event-free survival, was clearly improved. So these results have already been published in Journal of Clinical Oncology in 2021. So 1-year event-free survival was at 73.4%. So this has already been published, and now we presented the final analysis of this trial. So the final analysis after a median follow-up period of 72 months, so 6-year follow-up. So far, this is, beside all the other trials with perioperative immunotherapy that are now published, this is the trial with the longest follow-up in this patient population. So after a median follow-up time of 72 months, we have a median event-free survival of 4 years and a 5-year event-free survival rate of 45.9%. The overall survival after the median follow-up of 72 months was the median was not yet reached, and the 5-year overall survival rate is at 65.8%. What we were able to see is that the pathological response is an important predictor of outcome. So overall, we had 18% of patients with a PCR, so pathological complete remission. And of those patients, median event-free survival was not reached after a follow-up of 6 years. And the 5-year event-free survival rate for patients with a PCR was 71.4%. And the 5-year overall survival rate in this specific subgroup of patients was 100%. And also MPR, so major pathological remission, was a predictor of outcome. So patients achieving an MPR achieved a median event-free survival that was not reached after 6 years, and a 5-year event-free survival rate of 65.7%. So, the SAKK 1614 trial was the first trial actually investigating neoadjuvant and perioperative checkpoint inhibitors. Now we have the results of several randomized trials. So this is now a new standard of care. What our trial adds is now really the long-term follow-up of these patients, supporting the use of perioperative immune checkpoint inhibition. And it clearly shows us that the pathological response is an important predictor. So therefore, our follow-up trial, the 1618 trial, now aims at again improving pathological response by the use immune modulatory radiotherapy. So it is, on one hand side, it's the basis for all the further trials that have now been published and that lead to a new standard of care. But it's also a hypothesis generating for future clinical trials in this setting.